Hello guys, so beta exam is now over. I hope all you are enjoying with your family and definitely you have to spend this time with your family because from past several months you worked a lot. So this time some new things also was there in the examination. Video was actually given in the examination and this time you have to be start the video, you have to see the videos and then you have to answer the MCQs. बिकॉज पहले वो लोग सिर्फ आपको इमेजेस दिया करते थे और कुछ ग्राफ दिया करते थे बट दिस टाइम दे इंट्रोड्यूस फर्स्ट टाइम इन द हिस्ट्री that video based MCQ was there. So now onwards who are that going to appear in the next examination and those who are watching this video, I would say from my side guys, you have to be start smart studying for your upcoming future examination because examination can be up to the next level in the upcoming years. So you have to be work a lot and you have to be work hard. So let's discuss about this physiology recall session guys. This time there was all the questions from the physiology which they ask. Actually language was little bit tricky but those who have been studied from the concept based, जिन्होंने अच्छे से concept को पढ़ा था, अच्छे से concept को समझा था बेटा, they can easily apply that language even. So I would say rather than to routing all the things, सबको रटने के अलावा बेटा you have to be understand now on what's the mechanism, the concept behind it, and this basic fundamentals are quite necessary is going to be happen for your nearby FMGE's examination. In this recall based questions guys, I just took this recall from the several students, so there could be might be some changes of the language of the question or some option can be changed. So if you find anything that need to be changed, just comment me on the chat box and I'll update it from my side. So let us start talking about the first question. This question previously they also asked from the pressure volume curve and the pressure volume loop curve was given and they asked the pressure volume loop of left ventricle is shown, which of the following event is occurring at point E or arrow. Guys, in this image कुछ स्टूडेंट ने कहा था मेरे को कि सर यहाँ पे कुछ arrow लगाया था and somebody told me sir that E point was mentioned over there. So whatever it is, but during the classes we discuss that this is the phase, this is the exact image which you actually studied in the workbook. So during this phase what is happening, that is the rapid ejection and slow ejection phase. So this is actually the ejection phase duration and this ejection phase duration is actually given in the option. So what was the option? Option A was isovolumetric contraction with both mitral and aortic wall closed, isovolumetric relaxation with both mitral and aortic wall closed, ejection of blood from the left ventricle and opening of the mitral valve and a rapid ventricular filling. So definitely the right answer of this question is option number C. Option number C, that is ejection of blood from the left ventricle. Now talking about the second question, this time the ABG which they ask with the anion gap. And guys, anion gap के बारे में अपन ने क्लास के अंदर भी बात करी थी with the workbook, what is the anion gap and what is the normal anion gap, and the normal anion gap which I mentioned in the classes also, it was 8 to 16 milliequivalent per liter. And what ions actually have to be measured? You have to be measure first of all that cation, that is sodium, and then the chloride and bicarbonate, that is the anions. So the question was asked, a 32-year-old man presents with the breathing difficulty and generalized weakness. ABG analysis was given, pH 7.21, CO2 was 26 and bicarbonate is 11. तो यहाँ तक तो आप लोगों ने इसको अच्छे से solve कर लिया था because the trick which I told you during the classes guys, you never forget it. Okay, so what is happening? Who is the culprit? This is acid. This is actually acid. This low PCO2 means alkaline and this low bicarbonate means acid. So who is the culprit? Culprit was the bicarbonate. So this is actually the case of metabolic acidosis. So two options is already ruled out, this one and this one. This is not about the respiratory, this is about the metabolic. Now you are having two options with the metabolic acidosis and there is mentioning low anion gap with high anion gap. Right guys, so guys please pay attention, आपको इसमें anion gap निकालना था and actually the right answer of this question is, you would say either this could be high or either this could be normal, right? तो कुछ लोगों ने कहा था मेरे को कि सर यहाँ पे हाई एनायन गैप तो दे ही रखा था लेकिन एक ऑप्शन नॉर्मल का था, लो का नहीं था. तो अगर ये लो का नहीं था और अगर यहाँ पे नॉर्मल है, देन द राइट आंसर विल बी सी. लेकिन अगर यहाँ पे नॉर्मल नहीं दे रखा है, एंड इफ दे हैव बीन गिवन द लो एनायन गैप एंड द हाई एनायन गैप, देन द राइट आंसर विल बी डी। ओके, तो बेटा दिस इज प्योरली ऑन द बेसिस ऑफ द एग्जामिनेशन। उन्होंने क्या पूछा था, उन्होंने लो एनायन गैप और हाई एनायन गैप करके दो ऑप्शन दिए थे, या फिर नॉर्मल एनायन गैप और हाई एनायन गैप करके ऑप्शन दिया था। तो दोनों के अंदर से अगर नॉर्मल दिया था एंड ये वैल्यूज दी गई थी सोडियम 138 एंड क्लोराइड 112, then you could say that this is positive ion sodium, that is 138, negative ion that is chloride, and bicarbonate, and you are having the chloride value is 112 and bicarbonate is 11. So you would say 138 minus 123, and this would come 15. So this 15 is actually, you can consider normal anion gap. High anion gap you will consider if this is more than 20 milliequivalent per liter. So अगर यहाँ पे नॉर्मल दिया हुआ था देन यू वुड आंसर द नॉर्मल एनायन गैप, लेकिन अगर हाई एनायन गैप दिया था, नॉर्मल नहीं दिया था, तो दिस इज नॉट द लो, द नेक्स्ट चॉइस विच यू कैन आंसर दैट इज हाई एनायन गैप। ओके, सो डिपेंड करेगा क्या उसमें दिया गया था। Coming to the next question, a 28-year-old man is brought to the emergency department after a road traffic accident. On neurological examination, he has weakness of the left lower limb. Sensory examination of the left leg reveals fine touch, vibration, proprioception are preserved. Pain sensation are absent. Which of the following tract is most likely affected? The spinothalamic, dorsal column, corticospinal, and the spinocerebellar tract. तो guys, clear cut examination एग्जाम के अंदर पे आपको बताया गया था फाइन टच, वाइब्रेशन एंड द प्रोप्रियोसेप्शन आर प्रिजर्व्ड, और ये जो सारे हैं दीज ऑल आर कैरीड बाय द डोर्सल कॉलम। इट मींस डोर्सल कॉलम इज ओके। देन पेन सेंसेशन आर एब्सेंट एंड पेन सेंसेशन इज टेकिंग बाय स्पाइनोथैलेमिक ट्रैक्ट। स्पाइनोथैलेमिक ट्रैक्ट ये अपन ने बेटा मोस्ट एक्सपेक्टेड वाले वीडियो के अंदर भी डिस्कस करा था जस्ट बिफोर द एग्जामिनेशन, और उसमें मैंने आपको बताया भी था कि यू हैव टू बी रिमेंबर अबाउट द मल्लिका स्टोरी। ओके, सो राइट आंसर ऑफ दिस क्वेश्चन इज ए, स्पाइनोथैलेमिक ट्रैक्ट। सो पेन एंड टेम्परेचर इज टेकिंग बाय द स्पाइनोथैलेमिक, फाइन टच, वाइब्रेशन, प्रोप्रियोसेप्शन बाय द डोर्सल कॉलम, corticospinal, there are two corticospinal, ventral and lateral, and they will take the motor function, and the spinocerebellar, this is for the coordination function. Coming to the next, a 4-year-old child is brought with the recurrent seizures, development delay, and episode of the confusion that worsened during fasting. CSF analysis shows glucose markedly decrease. Blood glucose is normal. Which of the following glucose transporter is most likely defective? Guys, CSF का पूछा था, and the option is given GLUT1, 2, 4 and 5. मेरे को यहाँ पे बताया कि सर GLUT3 ऑप्शन के अंदर नहीं दिया गया था, राइट? देयर वाज नो GLUT3 इन द ऑप्शन, GLUT1, 2, 4, 5. So please correct me if something was there, okay? If GLUT3 was given over there or not, so please correct me and write me in the comment box. If the question is asked in the same way, the right answer of this question is GLUT1, okay? GLUT1. चाहे GLUT3 भी दिया हुआ हो, even the right answer will be the GLUT1, okay? Because GLUT5 is for the fructose. 4 is for the adipose tissue, skeletal muscle, cardiac muscle, like this. So this is the table which you studied in your workbook, and there is clear cut mention that GLUT1 is for the blood brain barrier, kidney, RBC, GLUT2 for the liver, pancreatic, beta cell, small intestine, GLUT3 for brain, neurons, placenta, and GLUT4 is skeletal muscle, cardiac muscle, adipose tissue, and GLUT5 for the fructose, that is present at the enterosite of the intestinal epithelium in the luminal side. The next question is, a 67-year-old retired army officer present with progressive difficulty in performing his morning routine activities, such as combing his hair, climbing stairs, and getting out of the bed. He reports that his muscle strength improves after repeated activity as the day progresses. Neurological examination reveals proximal muscle weakness. Which of the following abnormality is most likely responsible for this condition? तो आपको सबसे पहले इसमें diagnosis बनाना था guys, and diagnosis is actually you can make on the basis of some clue which is given in the option, given in the question, right? So please look at over here. Person is having difficulty in morning, right? So morning activity he cannot perform, but after some time, as the day progress, after some time, just wait guys, my pencil is not working. Yes. So morning he is not feeling well. Then after some time, as the day progress, condition improves. Condition improves, right? And this is the clear-cut case of Lambert-Eaton syndrome. Lambert-Eaton syndrome, right? Guys, we discuss in the class. We discuss in the class that in Lambert-Eaton, what is happening? There is calcium is not able to enter inside this neuromuscular junction. And guys, what is happening with that? This snare protein is not getting activated at this area, and exocytosis of acetylcholine was not happening. और अगर acetylcholine यहाँ से बाहर नहीं निकल रहा था, तो what was happening? The activation or that mechanism of this postsynaptic area was not happening, right? So this is actually the condition where the calcium channel get mutated. This condition we were calling Lambert-Eaton syndrome. और Lambert-Eaton में मैंने बताया था morning is worst, evening was better. Guys, यहाँ पे था acetylcholine का receptor. If this receptor is damaged due to autoantibody reaction, now what could be happen? All this thing will be happen, but this neurotransmitter cannot bind with this receptor and function cannot be initiated. And this condition, when the receptor is damaged, we called as myasthenia gravis. And myasthenia gravis you can ruled out by the Lambert-Eaton only with the one condition, that in myasthenia gravis morning will be better and evening will be worse. So this will be the vice versa condition of the Lambert-Eaton syndrome, right? So this is the same scenario. If you could make the proper diagnosis, guys, you can easily identify what is the right answer. And the right answer of this question was, there is the autoantibodies against presynaptic voltage gated calcium channel. This was the right answer of this question, right? Next question is, a person after several hours of the repeated muscle contraction, he develops muscle rigidity, hyperthermia and elevated serum creatinine kinase level. The physiologist explains that this is increased, that the increased heat production is due to the excessive cycling of an ion from the sarcoplasmic reticulum. Which ion is primarily responsible for this phenomena? Guys, right answer of this question is calcium. So excessive calcium released from the sarcoplasmic reticulum leading to all this condition, and this we studies in the classes. This was the diagram which you studied multiple times, and you know that this is the sarcoplasmic endoplasmic reticulum, which is that bank of the calcium. और ये कैल्शियम चाहिए था अपने को मसल कॉन्ट्रैक्शन के लिए, जो बाइंड होता था विद ट्रोपोनिन सी. एंड हु वाज द गेटकीपर? गेटकीपर वाज द राइनोडिन रिसेप्टर. सो दिस राइनोडिन रिसेप्टर व्हेन ओपन्स, कैल्शियम मूव्स आउट, इट बाइंड्स विद द ट्रोपोनिन सी एंड लीडिंग टू द मसल कॉन्ट्रैक्शन बाय एक्टिन मायोसिन कपलिंग. जब भी मसल का कॉन्ट्रैक्शन होता है बेटा, देयर इज ऑलवेज द जनरेशन ऑफ द हीट, राइट? So mutation of ryanodine receptor leading to the uncontrolled calcium efflux from sarcoplasmic reticulum, and this leading to heat production called as hyperthermia, and the treatment of this condition is dantrolene sodium, right? Dantrolene sodium. So this is the right answer of this question. Next is, a healthy 25-year-old volunteer participate in a renal physiology study. He is first administered creatinine and later inulin to estimate his GFR. The result obtained from both tests are compared. Which of the following statement is most accurate regarding the relationship between their clearance? Guys, please pay attention. This is the clear-cut MCQ. अगर आपको क्रिएटिनिन का क्लियरेंस पता था और इनुलिन का क्लियरेंस पता था, you can easily answer this question. I just told you in the classes also, जो क्रिएटिनिन है, क्रिएटिनिन क्लियरेंस was 139 and inulin clearance was 125. So what was happening with the creatinine? If suppose this is your glomerulus, this is the PCT, then the loop of Henle and so on, and suppose this is your afferent arteriole, glomerulus and the efferent arteriole. So this is Bowman capsule, this is glomerulus, this is afferent arteriole, this is efferent arteriole. So guys, what happens when the creatinine is going via this afferent arteriole over here? यहाँ पर ये ग्लोमेरुलस पे जब पहुंचता है तो व्हाट इज द जीएफआर रेट? जीएफआर रेट इज 125. So 125 creatinine will be filtered from this area. But from this blood area, total 139 need to be clear. So what is going to be happen? Later, the remaining part of the creatinine which still remain in the blood, this will come out directly into the tubule we call as secretion, right? Secretion from the tubule into the tubule from the blood vessel, right? From the blood vessel. Now guys, what happens? 125 creatinine will comes from the glomerulus side, 14 creatinine will come from the blood vessel side, and ultimately body will lose 139. So what was happening with the creatinine? Initially it filtrating and later it is secreting whatever remaining into the blood. What is happening with the inulin? Inulin when reach into the afferent arteriole, the clearance rate of the inulin is 125. And what is the GFR? Same 125. तो ये यहाँ से उतना ही निकल जाएगा और यहाँ से आगे भी ये इतना ही निकलना चाहिए. तो if already inulin, whatever the clearance rate is there, that inulin is already filtered, it is not going to be secrete and it is not going to be reabsorbed. So this is the relationship between the creatinine and the inulin, and the option which is given, option A was given, the creatinine clearance and inulin clearance are exactly the same. No, this is not at all true statement. This is the wrong statement. The creatinine is filtered and little secreted by the renal tubule. Yes, this is the true statement. Inulin is initially filtered, later it is reabsorbed by the renal tubules. No, it not reabsorbed, not secrete. And the creatinine is freely filtered and extensively reabsorbed by the renal tubule. No guys, it is secreted by the renal tubule. So this is also wrong statement. So this was the relationship between the inulin and the creatinine is you need to be remembered. So creatinine clearance is always more than the inulin clearance. You have to remember this part. And also the inulin clearance is gold standard because it is having the same clearance rate like the GFR, and creatinine clearance is slightly overestimate than the GFR. But remember, most clinically used, if in the future question asks most clinically used method for GFR estimation, then you should answer creatinine. If question asks best, inulin. If question asks most clinically used, creatinine, right? You have to remember this one. This is something new graph which you never studied before, I hope that. So this was the curve which is actually asked in your examination, and this is that length tension relationship from the sarcomere part. So the question was given, a 26-year-old man is undergoing a muscle physiology experiment. The graph shown represents the length tension relationship of the skeletal muscle, and the point mark C lies at the peak of the bell-shaped curve. The point mark C represents, and in the option they have given active tension, total tension, passive tension and the resting tension. Please pay attention guys. With this graph, actually ये कुछ नया ग्राफ था जो फर्स्ट टाइम आपके एग्जाम में पूछा गया है. In this graph, the point A, this is defining the total tension. Point B, this graph is defining the passive tension. And this is defining the active tension. So this is how the three lines actually giving into this graph. One for the total tension, another one for the passive tension, and one for the active tension. They ask in the MCQ that what is the point C. तो अगर उन्होंने C के लिए पूछा था, then it must be active tension. लेकिन अगर उन्होंने इस लाइन के पूछा था, तो guys it should be the passive tension, right? The passive tension. So if they ask point C, then the right answer of this question is A, that is active tension, right? Active tension. Now the next question. So please remember about the passive tension. It produced by the elastic structures like the titin connective tissues. right? Active tension is produced by the actin myosin cross bridging formation, and the total tension is passive plus active, we call as total tension of the tissue, right? So the next question, a 28-year-old man is brought to the emergency department following a road traffic accident. He is hemodynamically stable but has sustained a spinal cord injury. During evaluation, cystometry is performed. The tracing shows that as soon as a small amount of urine enters the bladder, micturition occurs immediately, and the patient is unable to voluntarily control the urination. Which of the following bladder abnormality is most likely cause? This is the graph of the cystogram which actually was given in your examination, and the options were given atonic bladder, dystrophic bladder, automatic bladder and the autonomous bladder. तो बेटा अब की बारी उन्होंने सिस्टोमेटोग्राम से, जो हर बार वो क्वेश्चन पूछते हैं, थोड़ा सा उसको डिफरेंट वे से उन्होंने अब की बारी पूछा है आपके लिए. एंड द राइट आंसर ऑफ दिस क्वेश्चन इज एक्चुअली द ऑटोमेटिक ब्लैडर. ऑटोमेटिक ब्लैडर. दिस automatic bladder, what is this? Please pay attention. In the spinal cord lesion above the sacral micturition center, if any injury is going to be happen, what is going to be happening? That micturiation center is going to be lost, and that inability to control the micturition from the higher center is going to be happen for the patient. तो क्या होएगा अगर यहाँ पे उसके पीछे चोट लगेगी, तो वो ब्रेन से जो कंट्रोल कर पा रहा था टू द डेट्रूसर मसल बाय द सिंपैथेटिक पैरासिम्पैथेटिक कंडीशन, नॉट एबल टू कंट्रोल बाय द पर्सन. This lead to what? This lead to the micturition reflex going to be over aggressive, right? Over aggressive, and exaggerated, and this will lead to happen what? कि जब भी ब्लैडर में थोड़ा सा भी यूरिन आएगा, द ट्रूसर मसल इज गोइंग टू बी स्ट्रेच, और जैसे वो स्ट्रेच होगी, गाइस द स्ट्रेच रिसेप्टर विल बी फायर and automatic micturition will be start. So this is happening automatic. Why? Because due to the micturition reflex exaggeration, this condition is happening because person is not having control with the mind. So this person is only having the control with the spinal cord level, and this is we call as automatic bladder, right? Automatic bladder. Atonic bladder means bladder आपका completely ही आपका वर्क नहीं कर रहा है, वहां पे आपके सेंसरी मोटर दोनों चले गए हैं. This is we called as atonic bladder, right? Atonic bladder. And this atonic bladder you can see in the tabes dorsalis, in the diabetic neuropathy. In such condition you will see the atonic bladder. और atonic bladder में क्या होएगा बेटा? There will be continuously dribbling will be there, right? There will be continuously dribbling. Over distended हो जाएगा वहाँ पे, bladder becomes over distended with overflow incontinence होएगा. बहुत सारा बढ़ता ही जाएगा, बढ़ता ही जाएगा, बढ़ता ही जाएगा, इस तरीके से वहाँ पे काम होएगा, right? Now the next question is, a 6-year-old child is brought to the pediatric OPD with a history of recurrent respiratory tract infection, chronic cough, bulky foul-smelling mucus from the throat, and the failure to gain weight. A diagnosis of cystic fibrosis made. The primary defect in this condition involve which of the following ion channel? Bread and butter question beta. And right answer of this question is chloride channel. इस टाइम बच्चे ने बताया था मेरे को कि सर 2 से 3 सवाल सिस्टिक फाइब्रोसिस से डायरेक्ट आए थे. एक में मैकेनिज्म पूछी थी, एक के अंदर पे कोई विटामिन के बारे में पूछा था. बेटा विटामिन वाला सवाल मेरे को प्रॉपर्ली नहीं मिला है, तो whatever the options actually given in the vitamin question, you just write me in the comment box and I will update from my side that also. Okay, so right answer of cystic fibrosis is chloride channel. ये अपन ने क्लास में करा भी था कि this is the cystic fibrosis condition, there is a CFTR gene mutation and there is actually the chloride channel is going to be defected, right? So chloride channel is going to be defected. Sweat chloride test we do for the screening and the treatment is ivacaftor. Also we discuss with for the Kartagener syndrome. बेटा कार्टागेनर में आपकी जो सीलिया थी वो एब्सेंट हो गई थी. Why? Not the absent means cilia become immobile. Why? Because the absence of the dynein protein. And the mnemonic I told you, that is the BDS, bronchiectasis, dextrocardia, sinusitis. And this is the clear-cut condition. Whenever you will see this prior, this is the clear-cut condition of the Kartagener syndrome, right? So right answer of this question was chloride channel. Next is an 8-year-old boy present with a history of recurrent chest infection, chronic sinusitis and persistent productive cough since childhood. X-ray shows dextrocardia. Which of the following is going to be most likely underlying defect? Guys, right answer of this question is Kartagener syndrome. तो कुछ बच्चों ने मेरे को बताया कि सर कार्टागेनर का भी क्वेश्चन था और उसमें ये सारे सिनेरियो दे रखा था, तो प्लीज कंफर्म मी वेदर दिस क्वेश्चन वाज देयर और नॉट. ओके, The next question is, a 5-year-old child present with the recurrent chest infection, steatorrhea, failure to thrive, genetic testing reveals a mutation in CFTR gene. Again, बेटा बार बार उसने एक ही चीज पूछी, and this mutation is most commonly associated with which of the following disease? Again, the right answer is cystic fibrosis. The next question, उन्होंने कुछ दो आपके फ्लास्क टाइप के कुछ बनाए थे या सेल कुछ बनाई थी, समथिंग लाइक दिस, एंड दे हैव बीन मेंशन्ड ओवर देयर, कंपार्टमेंट ए एंड कंपार्टमेंट बी. ओके, so two compartments are separated by a membrane that is freely permeable to the glucose and water but impermeable to fructose. So suppose they mention something like this, there is a semi permeable membrane. Through this membrane fructose cannot go out from one compartment to another, but glucose can move and water can move, right? Water can move. So this was from the body fluid chapter. So after the sufficient time has elapsed and equilibrium is reached by the comparing A and B, which of the following statement is true? तो आपको इन दोनों को compare करना था, and then you have to be choose the right option, right? So guys, first of all, please see over here. यहाँ पे जो टोटल वाटर उन्होंने लिया है, दैट इज 1 लीटर इन कंपार्टमेंट ए एंड 1 लीटर इन कंपार्टमेंट बी. ग्लूकोज जो मेंशन करा हुआ था इन कंपार्टमेंट ए, देयर विल बी द 2 मोल एंड फ्रक्टोज वाज 1 मोल, एंड इन कंपार्टमेंट बी ग्लूकोज वाज 1 मोल एंड फ्रक्टोज वाज 2 मोल. सो सी ओवर हियर, अगर अपन इसमें बात करें कि 1 लीटर वाटर के अंदर पे टोटल अपने पास में यहाँ पे कितना ग्लूकोज है, दैट इज 2 मोल्स, राइट? 2 मोल्स, एंड इन दिस कंपार्टमेंट इज 1 मोल. So if the equilibrium is going to be happen, what need to be going to happen? This glucose need to be moved from here to here or either from here to here, like this, isn't it? So total glucose will be, the total glucose will be in both compartment, total glucose will be 3 mole. So for making the balance, how much one compartment should carry the total glucose? Half of them, that is 1.5 millimole. So 1.5 mole glucose need to be present in one compartment, right? So in this compartment 1.5 and in this compartment 1.5. So what will be happening from compartment B, from the compartment B where the 1 mole of the glucose is present, from the compartment A the glucose start moving this side because this membrane is semi permeable, right? So glucose will start moving toward this side, and this is going to be happen. So you can see over here that after the sufficient time of equilibrium, what's going to be happen, right guys? What's going to be happening? The glucose concentration become equal in both compartment, right? And what about the water? The water is going to be moved from which area to which area? From high osmolarity side, from the low osmolarity side to the high osmolarity side, water is always moves. So this is how the water is going to be moved. So if the we'll talk about the water, this water will start moving from compartment B to compartment A, from high osmolarity to the high osmolarity side from the low osmolarity side, right? So this is how the water is going to be moved. तो कम से ज्यादा की तरफ, जहां पे osmolarity ज्यादा है उधर की तरफ वाटर मूव करेगा. So water will move from compartment B to compartment A, and glucose will move from compartment A to compartment B and become balanced like this, equilibrium, right? So let's talk about the one by one option. Glucose concentration become equal in both compartment. Yes, this is the true statement. What water moves from the compartment A to compartment B because glucose concentration is higher in compartment A? No guys, this is the false statement. Water move from compartment B to compartment A because fructose concentration is higher in compartment B. Guys, definitely water will move from compartment B to compartment A, but not due to the fructose, because fructose is less over here. But this is not due to the fructose, this is due to the glucose. So this is not due to the fructose, this is due to the glucose. So again this become the false statement. And D, that is the fructose concentration become equal in both compartment. No, membrane is completely impermeable for the fructose, so this is not going to be happen, this is not going to be equal. So again this is the false statement. So what is the right answer? Right answer is A, glucose concentration become equal in the both compartment. The next MCQ, that is A 55-year-old man is undergoing laparoscopic pelvic surgery. During the procedure, he is placed in the Trendelenburg position. What is the Trendelenburg position? जब आप लेग को ऊपर उठा देंगे एंड हेड को डाउन कर देंगे. Which of the following physiological effect is most likely to occur in this position? तो बेटा अगर आप किसी को सुपाइन पोजीशन के अंदर से लेग को ऊपर कर देंगे और हेड को नीचे कर देंगे, what is going to be happening? Venous return will be increase, so preload will be increase, more blood will go towards the heart, ज्यादा इधर जाएगा, जितने भी आपके एब्डोमिनल ऑर्गन्स हैं वो नीचे की तरफ आ जाएंगे वापस आपके चेस्ट की तरफ टुवर्ड्स द थोरेसिक एरिया एंड दे विल कंप्रेस द डायफ्राम. डायफ्राम पुश होएगा ऊपर की तरफ, लंग्स विल हैव द लेस एरिया टू बी एक्सपेंड, राइट, लेस एरिया टू बी एक्सपेंड. बट व्हाट अबाउट द पेल्विक रीजन एरिया? जितने भी पेल्विक रीजन एरिया के ऑर्गन्स हैं वो सारे नीचे मूव हो जाएंगे, तो देयर विल बी मोर स्पेस यू विल गेट. और जब भी सर्जन को ज्यादा स्पेस चाहिए, they can do something like this position, right? So this is actually used by the surgeon in the OT, and this is we call as Trendelenburg position. Guys, what is going to be happening? There will be increase the venous return and cardiac output will be increased, BP will be increased. So this is the basic concept. Even if this picture is not given and they just ask कि भैया जब अपन किसी को सुपाइन पोजीशन के ऊपर पे जब लेग को रेस कर देते हैं, व्हाट्स गोइंग टू बी हैपन, बट दे एक्चुअली mixed few things from the surgical side to the physiological side together, and this is how actually this time they are trying to make these MCQs. So बेटा आपको concept बहुत पकड़ना जरूरी है. अगर आपने concept नहीं पकड़ा guys, you will always feel more and more trapping like condition कि आपको समझ में नहीं आएगा कि सर क्या पूछ रहा था, कैसे आंसर करना था, something like this. So the option were given over here. The increased venous return, increased cardiac output. Yes, this could be happen. This is the true statement. Decrease venous return, decrease cardiac output. No, this could not be happen. Decrease intracranial pressure and decrease central venous pressure. No, guys. If all the part will move towards the head, so guys, what will be the intracranial pressure? Increase. Intraocular pressure increase. So everything will be increased. So again, this is the wrong statement. Decrease preload due to the pulling of blood in lower limbs. No, guys. If you will do the head downside and leg upside, blood pulling will towards the head side, not towards the lower limb side. So again, this is the wrong option, right? So right answer of this question is increase venous return and the increase cardiac output, right? So this is the Trendelenburg position, head down, feet up, blood shifts from lower limb towards the thorax, so that increase venous return, increase CVP and increase the stroke volume and cardiac output initially. So guys, this is all the question they ask in this FMGE June 2026. So if you find any suggestion or you find any options is not there up to the mark or some language was differ, you can mention me in the comment box. I welcome all your comments and your suggestion guys, and this is all from my side. Thank you very much, and wish you all the best for your great result, right? Thank you.